Hey y'all, welcome back to the Pink Envelope. As you can see, there is no box here. We're actually filming a completely different video than you would ever have seen on the channel before. We're gonna talk about healthcare insurance. I know, super fun topic, right? But it's a question I get pretty often from various people as an entrepreneur. We don't have company provided insurance, and we haven't had company provided insurance in almost 20 years. So we have used healthcare sharing. I have notes here in hopes that it keeps me a little more on track. Healthcare sharing is sharing of healthcare needs amongst a group of people, which I guess would be called my network, and splitting the cost to pay for needs. I think when I say that initially, it seems like it's a really expensive thing, but does that change your mind if you find out for all of my health insurance a month, we only pay up to $575? Yeah, it's actually very, very, very affordable. And I say up to $575 because I pay my subscription fee, my membership fee. It's $50 per person, so it's about $206 a month. The $50 per person plus a processing fee. That's my subscription fee, my membership fee. And then I split any costs that come in up to $375 additional. So I will never pay more than the $575, which is fabulous. All of the different healthcare sharing plans follow the same structure. Their rates are different based on what you opt into, but it follows that same type of plan. And there are several out there. We've done Samaritan Ministries, which is a healthcare ministry for people of religious backgrounds. Fabulous. Highly recommend. There is CHM, also known as Christian Healthcare Ministries. It's okay. We had that one for a bit. It wasn't my favorite. They have a sister company called MediShare. I've never personally been insured by them, but I did manage somebody else's plan for them who was through MediShare. It was okay. It's just indifferent. We're with CrowdHealth now. So that's the one I can talk to you the most about. I can talk to you about Samaritan as well if you have specific questions. But we're with CrowdHealth. So CrowdHealth is not an insurance company. It's a healthcare platform that uses crowdfunding to manage healthcare costs. And so depending on how many people are in your family, your rates change. So if you don't have a family of 4, but you are just a single person, or maybe there's just a couple, you're going to have a cheaper rate than me. So I do recommend if you go down into my description, I have links for those companies that I've mentioned. There are more than that. I think there's one called like Trinity. There's several of them. I can't dive into all of those, but I can talk to you about the ones I'm using now. But the links down below are a great way to dive in and just start looking into what is healthcare sharing. You may find that it saves you $1,000 or more a month. I'm not getting paid to say this. Nobody knows I'm filming this video. I'm sitting in my office with my Stanley by myself. Just felt this need during this, what is it, the open enrollment. I had to write down the word. I don't even know what the word is. Open enrollment, to share with you guys that there are other options than conglomerate, big, massive insurance companies. There's small business CrowdHealth funding that is wonderful, and they're happy when you join, like truly joyful. So let's see. What do I have here? Pros and cons of CrowdHealth, which is the healthcare sharing we're with now. Pros, there's no traditional insurance policies. There's no networks. There's no deductibles. Like, we don't have to meet $2,500 per this, that, or the other. No, we don't have any of that. There is maximum monthly contributions that, like I said, I'll never pay more than $575. There is a great community to lean into. I have a healthcare advocate, which is my concierge who helps me with things. It's wonderful. They're on the app and they're a text message away. It's super fast. I guess a con would be that CrowdHealth in particular is a newer company. So, I mean, I don't see that as a con, but I could see somebody being nervous because they're newer. But if you pick somebody like CHM or MediShare or Samaritan, they're not new. They've been around for, I don't know, 20 years plus. So you'd be moving into a more veteran company. So some of these companies I'm mentioning do target people of religious backgrounds, and their rules do apply to that. But then the other ones I'm mentioning, like CrowdHealth that I'm on now, do not do that. So I do highly encourage you, as you're like noodling if this concept is a match for you, to go down and grab those links. Those links are very beneficial. Just jump on their FAQ real quick. Every one of these companies have their pages set up to answer questions because they know the healthcare sharing for most people is new. For CrowdHealth, I love it because it is extremely affordable. I can go see any doctor I want, when I want, how I want. There's no rules. I can get things taken care of. Unlike a lot of other healthcare sharing plans, CrowdHealth does cover your wellness checkups. Typically, with healthcare sharing, there is a number you have to meet before it's submittable. It's usually low. So you're responsible for the first 300, 400, 500, the different plans vary, of anything that you're doing before it's submittable. So if I'm just running to have a checkup, I pay the $100 and I walk out. That's not submittable. I go into the checkup, pay the $100, and they find out I have skin cancer. Now it's 100% submittable and they cover all of the cost. So there's those kind of things to be aware of. Once again, I have been doing healthcare sharing for over 15 years and I pay 50% less than everyone in my family who has traditional, company issued insurance. And same thing with friends. I run these numbers every single year and we pay so much less. So for example, whenever I had Emma, we paid our monthly membership fee of $500 or whatever it was, and that was it. There's no deductible to meet. I saw whatever doctor I wanted, when I wanted. I handpicked my anesthesiologist who did my epidural. So there's some really, really big benefits there. I could go on and on, but there are like endless number of questions that could come through. So what I'm going to say is enter your questions down below. If it's about Samaritan Ministries, I probably can help you really well. Christian Healthcare Ministries, I may or may not be able to help you. I was only with them for a year before I got frustrated. In CrowdHealth, I can partner with my healthcare advocate and we can get 100% of your questions answered. Once again, nothing sponsored. I am truly doing this legwork because I'm hoping that you guys can save hundreds to maybe even up to 1,000 per month on getting out of the rat race that is healthcare insurance. I don't have referrals for the others because I'm not signed up with them, so I don't have referrer friends. But if you are interested in CrowdHealth, go down below. I do have my referrer friend code and link down there. And if you sign up using those, your first 3 months are only $99 each. The first 3 months of insurance will be $300 for your membership, which is crazy. It's crazy, but this is what happens when you work with privately ran entities. So put questions down below. I'm going to do my best to answer. Go to their websites and check it out. And I hope that this brief, somewhat wild, kind of just popping up out of nowhere video helps open the door to some new opportunities for families out there who are in the in-between during this open enrollment time and looking for other options. I have been with healthcare sharing for nearly 20 years and I highly recommend it. I hope that you guys are having an absolutely amazing day. And if you have subscribed to the channel, I'm going to see you guys later. Bye, y'all.